Hey there, and welcome to the Partner Pulse, your quick hit of insight into how IntelliStack and our partners are tackling real-world challenges together. I'm David Moeller, and joining me today is Bryan from WeInfuse. Bryan, we're going to hit four rapid-fire questions today. Does that sound good?
Sounds good.
All right, let's rock and roll. Okay, so question number one, it's not even really a question. Just kind of, Bryan, give me the elevator pitch on WeInfuse.
Yeah, WeInfuse. WeInfuse is a software, think about kind of a niche EHR dedicated to the medication delivery space. Started off infusion center, standalone infusion centers, physician office that do infusions and especially injections back in their practices. But we saw that there wasn't a software in the space dedicated to that workflow, and it's complicated and difficult. So we wrote one. Been doing it about 10 years, and now we've expanded into the pharmacy space, kind of the home infusion space, and we also now do rev cycle and a couple other things on the side.
Okay, so Brian, what I'm hearing there too is like it's your specialized EHR, and you're probably in your infusion clinics and whatnot, like running into some of the problems that traditional like a hospital might run into as well. So let's drill into that a little bit. So tell us a good use case we've worked on together, or the time we've had some joint customer success.
Yeah, no, absolutely, David. It was really important for us to work with IntelliStack, or formerly FormStack, right? I guess. Yeah, I mean, things. I mean, think about yourself as a patient. You go into a physician's practice, you go see your doctor, you go see your dentist, or whatever. You've got to kind of get. They need all this information from you to do their job and process insurance, take care of you. And you as a patient, you don't want to be hassled very much, right? You want to get there, you want to get back, see your doctor, get the answers you need. But there's really this exchange of information that needs to happen, and it's no different in infusion or injection pharmacy, any of that. You get the same kind of push and pull. I would say it's probably a bigger deal in our space because the drugs are so expensive. The therapies are very complicated, and there's just a lot that needs to happen before you ever even show up to get your therapy. And I think maybe that's the major difference. And so, our clients are really looking for a way, hey, how can I extend something to my patient to get that information, make it easy on the patient to get me that information electronically, of course. We don't want faxes and handwritten paper notes. And that way we could get that information populated and be ready faster, get the patient in, get them scheduled, get them treated with really accurate info. So we worked with the IntelliStack team to develop a
Yeah.
platform to do that, introduce it to our clients. We've just had a lot of success, and our clients are now hosting those forms on their web pages. They are sending those forms to their clients. And even just last year, we're coming to this part of the year they call the blizzard. It's a big deal. All the insurances have to be re-verified. Everyone gets new insurance in January. These patients need their treatments in January, so everyone's in a rush to get everything redone. So last year we had a client really take advantage of the forms, and the big one being the new insurance form. Sent it out to all of their patients through the IntelliStack platform, saying, "Hey, if you've had new insurance, fill out this form, upload, front and back copy of your new insurance card." And it was really cool. They had done this for years on their own through email and phone calls and whatnot. Never had a really good response. And that first year they did that, they had about a 75% response rate from their patients on that because it was so easy for them to get it on their phone, open it up, quickly fill it out, using their phone, auto-populate most of the information. They were able just to take a photograph of the front and back of their insurance cards and upload those all in the same form. So super easy process. That really made a big difference in their ability to kind of get that information in and get it processed for the new year.
Yeah, that's great. So, for people at home, yeah, you're telling a story that, will resonate with everyone. You picture this, you walk into your GP's office, right? And they hand you a stack of paperwork. There's crying children. There are people that are sick. You're looking at the fish in the aquarium, waiting, waiting, waiting. It's not a great customer experience, right? So,
No.
when you're going for these expensive drug treatments or just, basic infusion, you want to get in and get out. And it sounds like when you give people the opportunity to kind of like get all that sorted out in the comfort of their own home before they get to the waiting room, they can really kind of cycle the
Mhm.
patients through, and that's a great win for the patient, but also if you think about the clinic, the physician's office, they're probably able to crank out through more patients and get better throughput. So that's an awesome use case. Thanks for sharing that with us, Brian. I picked up on what you were talking about, how we're kind of a piece of the WeInfuse product, right? Like like a small piece of the
Mhm.
tech with the forms and whatnot. How would you characterize the success of our partnership? Would you say it's like you guys kind of carved out this niche space in EHRs, for these clinics, and we're just providing that extra boost with the Forms product that's kind of helping the user experience.
Yeah, I think it's the whole platform. I mean, we were looking at the complexity of, we knew all of our clients needed forms and needed the ability to send those forms, track those forms, have signatures completed on the forms for different things. But all of our clients kind of a unique business model. They have their own branding, their own processes. They all do different medications. Some of the physician offices are neurology, rheumatology, right? So they have a little different flavor. So FormStack gave us as a platform that we can extend to our clients and they can, kind of make it their own. They can make their own customized forms. They can put their own logos on there. The portability of the forms was important to us, so they can take that, that unique URL and they can post it on their website. They can put it in their patient portals. They can send the patient directly through our two-way secure chat that we have built into the app, or text it to the patient. So there's just a lot of portability that made it really flexible for the clients and made it modular. And that way, whether they're getting insurance information from a patient or a list of medications and allergies, or if they're having another physician fill it out in order to order the medication for the patient. So just anywhere information needs to be accurate, needs to be portable and movable. It's been a really good thing. And yeah, the FormStack made it. We didn't have to write all that software. We just had to write the integrations. And so as the IntelliStack, FormStack, process improves, our clients get the benefit of that. So we just feel like it's a good relationship.
That's great to hear, and I would characterize what you said is like there's a wide variety of ways to use this tech, right? So
Mhm.
that this is, and also you use the word flexible, right? So it's very flexible and customizable to a certain clinic's needs. I'm sure you have one clinic that is like heavily going to use it for insurance, but others might be like, oh, actually, this is an intake use case for us to
Mhm.
increase efficiency. So a lot of different ways to use our products together, and that's great to hear. Bryan, I'll get you out of here on one question I ask everyone. It's kind of like a prediction, if you will. We're towards the end of the year. We're recording this right around the holidays. 2026 is knocking on the door. What are you seeing in kind of the healthcare and pharmacy space moving forward to 2026? A lot of industries are kind of struggling with like, what's our AI strategy going to be? But in healthcare, kind of a legacy industry, they've got their own challenges with insurance regulations
Mhm.
changing all the time. What's something that you're keeping an eye on for 2026?
Yeah, everyone wants to talk about AI all the time. It's not to be ignored, right? So we're seeing think IntelliStack has got several AI processes in place now with their forms. I mean, healthcare is healthcare. It's very high touch, and there's a lot of people involved. So we're hoping that where AI can help us is bridging some of that and automating some of that those in between place. We're getting information from other physician practices, getting information from the patient, trying to get information to and from the insurance company. The IntelliStack system helps facilitate a lot of that, and then AI can kind of come in and knock out and automate a lot of those steps. That'd be really great. Right now, several places still takes a human to intervene into a process and say, "I see what's happening here, and it's stuck. I need to pull it out and pull in something else," and kind of fulfill that missing piece. So we're looking at more automation going forward where something intelligent, whether it's an AI agent or whether it's just a better dashboard, can alert the users to that need and fulfill that automatically. I just think patients are getting more and more used to technology, especially mobile technology. I think there's a big chunk of our patient population. I'll throw my parents under the bus a little bit here that just still would show up and want to fill out the clipboard. But I think we're kind of getting away from that now. And I think the adoption on the consumer side, at least on the patient side, is going to make a big difference in how healthcare is handled going forward. But yeah, a lot of it's going to be AI. I don't know what the new thing is going to be. I don't have a crystal ball, but it's healthcare, so it's going to be complicated.
Yeah, it's funny you say that. I mean, like we did a research report a year or so ago, and it's something like 65% of healthcare offices are still using fax machines, and it's like in 2024, what?
Yeah.
So, yeah, and I think a lot of what you're speaking to there is just driving efficiency, right? Like in healthcare, there's always going to be the need for the human touch, but ways that you can drive efficiencies, eliminate those bottlenecks. You think about like a hospital and someone's taking up a bed and there's all sorts of forms they need to move and discharge that person, and you're having all those same issues there. So if AI can help expedite those processes, improve the customer experience, it should be a net positive for healthcare in general. So Bryan, this was a lot of fun. I mean, I think you really spoke to the power of our partnership with WeInfuse and IntelliStack. And if there's people at home that have a private practice and you're struggling with some of these issues, come talk to Bryan, and I would love to help you out. And Bryan, thanks for stopping by the Partner Pulse. You're off the hot seat. Have a happy new
Yeah,
year.
thanks,
And
David. Appreciate it.
yeah, brother, we'll speak to you in the new year. And for our fans at home, we will see you next Tuesday with a brand new use case, brand new partner on the Partner Pulse. Thanks and goodbye.
Bye.